And the next morning I woke up, I was in crazy pain. I ended up tearing some ligaments and some crazy stuff. And they sent me to see a hand specialist. I had surgery and I woke up the next day and my arm started to swell like a balloon. And then I started getting this bizarre pain. It wasn't like the normal surgical pain. It was like a burning sensation. I felt like my arm was on fire. And I happened to have a friend in Florida who has an illness called complex regional pain syndrome.
So I'm super excited to bring on the show today with me Kimberly Juroviesky. She is a retired nurse practitioner and nurse midwife who trained at Columbia University and the University of Medicine and Dentistry of New Jersey. She was injured on active duty while in the US Air Force and developed complex regional pain syndrome, which unfortunately led her to retire early from her military career. Kimberly began getting ketamine infusions in 2015 as part of a research study. While they don't make her pain levels completely disappear, they do bring them down to what she describes as livable levels.
I was devastated. Being a midwife, being a women's health nurse practitioner, that was my life. Like my life was caring for people, and not being able to care for people anymore. I was just dead. I had no more reason to live. A friend of mine sent me a link to a research study at Hospital for Special Surgery, where they were doing a research study of ketamine infusions with an epidural versus placebo. So I was like, maybe I should try this. And then I started reading everything I could get my hands on about ketamine. And I got 5 days worth of infusions. And it was amazing because during that 5 days, the pain was zero. It was absolutely incredible. And my mood was so much better. I was like, wow, this is like amazing. And I went home from the hospital and I was like, this has changed my life. As ketamine clinics are booming all over the country, unfortunately, there are always going to be a few bad players who come on the scene. You can't give a patient something and not tell them what's in it. It's dishonest. It's not, I think it goes against medical ethics, honestly.